Another company on our radar today is Royal Philips. Once known as one of the largest consumer electronics brands in the world, has shifted its focus to health tech in the last 10 years. Now organized into three main divisions: personal health, connected care, and diagnosis and treatment. The company is a leader in diagnostic imaging, ultrasound monitoring, enterprise informatics, and personal health. With us now to discuss the evolution of the company, some of the recent challenges, and the future with AI, we want to bring in Roy Jakobs. He's the CEO of Royal Philips. We also have our very own health reporter, Anjalee Khemlani, joining us right now. And Roy, it's great to have you here in studio. So we can just basing it off the intro right there. And I know we've dug into the company here this morning. A lot of changes have taken place in a short amount of time. So talk to us just about where you are in the transition and the reliance that you have on AI technology going forward.
Yeah, you see that there's a huge healthcare crisis going on. And actually, I'm just coming off the back of the Chicago Radiology Show, 38,000 people joining us there, actually back to 2019 levels. And what's very clear, that there are just not enough people to take care of all the patients. So if you look at what we can do to support, then technology needs to really step in. And in that, AI is the next revolution that we can bring in to really make meaningful difference. And if you take an example, currently 70% of radiologists are reading from home because they need to read images over multiple hospital systems. Then actually it's very useful if you have AI helping and guiding them with the images that are transferred, but also how they can pre-read. You can do a pre-selection on negatives, but also indicate where they need to kind of put their focus on. We have another great example where actually in Buffalo, we are heading out with a mobile CT scanning program on the fire brigade, because actually, unfortunately, we know that there's a 60% higher chance probability of lung cancer if you are in the fire brigade. So we did a full screening program in the community by actually putting our CT with AI and very easy workflow outside of the fire brigade station so that everybody could get scanned. So you see that actually there are day-to-day applications here and now that can help the healthcare providers providing meaningful care with an enormous pressures system.
And certainly opening up a new avenue for consumer healthcare as we know it, because you have sort of this middle market that's not quite consumer, not quite clinician. And so that gives you the opportunity to create more products. We cannot start off the day, of course, without talking about the past. You have had the largest recall with the respiratory machines, and just recently the FDA called out again with overheating problems. Do you think that there's something to be said about how complicated it is to, in this world of high tech, create safe products for users to use that aren't in the clinical space?
Yeah, patient safety and quality is paramount. And that's something that also, when I stepped into the role, I said this is the number one priority for the company. We have put a world-class team on it, and we are working through the challenge and actually making significant progress. We also saw that coming in, how the Philips recovery over the full year is shaping up. We have now 4 quarters of growth. We are actually year to date ahead of the plan. We upped our guidance twice. And we're doing that under the umbrella of looking at healthcare and how we can provide the best quality care to them, looking at the time that we can give back. But of course, also making sure that in the application, for example, of AI, we do it in a responsible manner. We are part of a consortium, for example, in North America. The National Academy of Medicine has gathered tech companies, providers, regulators, government officials to look at a code of conduct that we are together developing for responsible application of AI. Because AI can come to the rescue, but of course you need to be aware of what it can and cannot do. There's a lot of routine tasks that you can go after now to get immediate impact, as I was just sharing. But of course, the closer you get to the patient, the more careful you need to be, whether you have really well tested it, whether you do it in an inclusive manner, and that's something we are doing with cross-industry participation.
Where do you believe are going to be the biggest kind of accelerants in terms of the order book right now? Because that, in the most recent quarter, down by about 9% year over year. So what are those catalysts, at least kind of from the sources of customers that you're looking across?
Yeah, so first, we see the source of improvement or strengthening of the healthcare system itself. Mm-hmm. When we are looking last year and this year, last year 7 out of 10 hospital systems in the US were negative territory. They've turned positive again. So you see that they are strengthening kind of in terms of their financial means. At the same time, also the challenges I was just calling out, they need to actually have solutions to deal and treat more patients. So actually also for them as a revenue generating engine. So that drives kind of also orders. At the same time, some of the software orders that we are talking about with AI also can come in through OpEx. So the orders that we are measuring, and if you look at Philips, 40% of our business is coming out of a CapEx order book. 40% is actually coming out of consumable services and software, 20% out of personal health consumer. So actually in that part where you saw the decline was the CapEx order book. Now we also see that actually strengthening. And then we see also the orders growing in the services side, and personal health is also coming back stronger. So where you saw at the beginning of the year, consumer were still more subdued. Actually, we saw now in this third quarter, we had 7% growth in the consumer segment, and we expect that to continue. Then there's another element, China, that actually played into the order book because China put in place new regulatory measures in the second half of this year, which actually does put the orders from China under pressure. That's a market pressure. We expect in 2024, as they work through their program, that will gradually return.
China, a country, that you've been in for 100 years, as we know you marked this year. But talk to me about the AI part of it, because there is this big push in healthcare in particular with regulation and the need for it. FDA Commissioner Robert Califf told us so just a few weeks ago. So what is it that is sort of stopping progress right now, or what needs to take place in order for you to be able to get your devices better flowing out there?
I think when you want to move healthcare, you need to think in a systemic manner. And therefore, 4 individual drivers have to line up. It's not only the technology and innovation. Actually, it's the clinical practice that is ready to adopt. So you need to actually train them and have them willing to work with new technology. Then it needs to be financially supported. So the reimbursement streams need to be adapted to also actually support the new technology. And then you have the regulatory stream that needs to come together. So that's also why we're working together to actually shape that. That does not mean that actually today you can do a lot, right? What we're discussing again this week is how can you actually get faster reading? We have an MR that actually with smart speed AI can have 3 times higher throughput of patients. So you can make the current system more clever, therefore actually treating more patients, which is great. But of course you need to look at it at a wider scale, and that actually then requires the full system to move.
Roy Jakobs, who is the Royal Philips CEO, and Anjalee Khemlani, Yahoo Finance's own, joining us here for the conversation. Thanks so much for taking the time today, Roy.
Thank you for having me on the show.
Appreciate it. Thank you.